I'm Lucy McDonald, physiotherapist. Welcome back to my virtual clinic. Today I'm going to talk to you about when you need to get your knee pain checked out immediately. But first I'd like to say thank you so much to all of you who have sent me lovely messages of support. I'm really glad that you found this series on keeping you and your family healthy at home so useful. Last week, as you know, we did back pain, the week before breathing and immunity, and then this week we're doing knee pain. Please don't forget to press the big red subscribe button to make sure you can watch these videos going forwards. So, when is it that you need to get your knee pain checked out immediately? The first and probably most obvious one is if you fall directly onto the knee, or if you fall and you twist the knee or do something to the knee where you suddenly get a really severe onset of pain. That's because that would indicate that you might have some kind of bony damage to the knee, and particularly if you can't weight bear through the leg. So if you're finding it difficult to put your body weight through your leg, then you absolutely must go and see someone to check that you don't have any fractures or breaks in the bone. That's because they can create long-term issues if they're either not immobilized or in some cases you might need surgery. So that's the first one. The second one is if you have a sudden swelling. So if you suddenly get swelling in the knee and it's red and throbbing, then in that situation you really should go and get your knee checked out, because it might be that you have an infection or something going on in the knee that does need immediate attention, and particularly but not only if you're feeling a bit unwell as well. So if you have soreness in the knee, inflammation in the knee, and you're generally feeling unwell, then you do need to go and get it checked out. And last but not least, if you can't fully straighten your knee, if your knee is locked, and not just because it's painful and you're finding it difficult to fully move the knee, but if your knee locks into one position, then that might be an indication that you might need surgery to make sure that you can get the movement back in your knee. So in all of those cases, do make sure that you do go and see your doctor. Next time what I'm going to do is talk to you about, if you do have knee pain, what you can do about it to treat it yourself at home. So please do press that subscribe button, and I look forward to seeing you next time. Bye!